Hello, you are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Okwan. Today's section, we want to quickly review the gross anatomy of the spleen. If you want the microscopic anatomy of the spleen, I've already done it. Yes, it's part of what we call the lymphoid organs that I've done. So it's an important organ of the reticuloendothelial, system. Yes, we know in fetal life it is, relevant as far as, erythropoiesis is concerned, production of red blood cells is concerned. But of course, postnatal life, it becomes the graveyard of these red blood cells. Yes, because these red blood cells, these aged red blood cells, the splenic macrophages will have to engulf them. Yes, that is what is going to happen. The aged red blood cells, or those abnormal red blood cells, will be engulfed and phagocytosed. Okay, so that is, one thing that we have to know. Yes, we know that it is a reservoir of blood. Yes, that is very important. And one thing is that it's very important in, fighting these kind of encapsulated, bacterial infections. Okay, that's very important. Yes, we are not going into that physiology, but what I want you to know as far as the anatomy is concerned is that, yes, this organ is an intraperitoneal organ. Yes, it's covered by, this kind of visceral peritoneum. Yes, except at its hilum, where of course we know that the hilum is related to the tail of the pancreas. Okay, that is that portion is devoid of this peritoneum. And we know that it's located in what we call the left hypochondriac region. And so, without much ado, let's review quickly what I have for you regarding the gross anatomy of the spleen. So there we are. Now, one important thing that we know about the spleen, okay, is that it's related to what we call the 9th rib, the 10th rib, and of course the 11th rib. Okay, we know the spleen works under a system of some kind of odd numbers. We talk about 1, 3, 5, 9, 11. Okay, we 9, 5, 7, and of course 11. And we know that, yes, in terms of length, breadth, and of course the height or the width, or in terms of breadth you can also say width, and of course the height, yes, that is called 1 inch, 3 inch, and of course 5 inches respectively. Okay, and of course we know that, yes, it's related to, of course, its weight is 7 ounces, which is approximately 198 grams, or something roughly 200 grams. Okay, that's the weight, normal weight of what we call the spleen. Okay, and then it's also related to what we call rib number 9 to rib number 11, but the left side, because we said it's located in the left hypochondriac region. And this organ, yes, you can see that is how it is obliquely placed, in situ. Okay, and this organ is actually having this kind of 2 ends. Okay, and one thing I want you to know is that this organ is having 2 ends or 2 extremities. Okay, now this is one of the extremities. This is what we call the posterior extremity, and this posterior extremity goes more medially. Okay, now what I'm saying is this is the more medial aspect, and as I come this way, I'm coming laterally. Okay, and this one is more anterior. As I go this way, I'm going more posteriorly. So the end over here, where it's roughly rounded in nature, okay, directed going a bit upwards, is what we call the posterior extremity, or the posterior end of what we call the spleen. Then as I come to the opposite aspect, this expanded region over here, which is directed, a bit inferiorly, okay, as you can see over here, but actually coming a bit anteriorly. This one, or going laterally, this one becomes what we call the anterior extremity, or the anterior end. Now get to know that this anterior end, extends towards what we call the mid-axillary line. It extends towards what we call the mid-axillary line. So if you take an imaginary line, yes, through the axilla, this anterior extremity will be getting closer to what we call this mid-axillary line. Yes, being a solid organ, then it makes sense that it will have a hilum. That's the gateway where those kind of neurovascular structures, okay, including lymphatus, yes, will be going in and out of the substance of the spleen. Okay, that is one thing that I want you to know over here. Now, for now, I will tell you something, but I will go on to show you again. Yes, you will see that on the superior aspect is going to have these 3 borders. This superior aspect, we find what we call the superior border, which is often notched. Okay, but I will tell you that this is not the notch that we are going to use it to show that this is a superior border, because sometimes this border over here, which we call the inferior border, could also be notched. Okay, but we will use something to because there will be another border over here which we call the intermediate border. So that is one thing that I want you to know. So we're going through all these ones as we move on. So there we are. Now if you look at the spleen, what happens is that it's going to have two surfaces. That surface which is related to the ribs, and for that matter the diaphragm, that is that smooth convex surface over here. That is what we call the diaphragmatic surface. And then as we move on, yes, if you look at it from the medial portion, we are going to have this visceral surface. Okay, this visceral surface, because important organs are related to it, which of course we are going to review all these ones. So we can see the two surfaces of what we call the spleen. This convex surface, okay, the diaphragmatic surface, and the visceral surface, which of course is having important relations with other structures. So there we are. Now at the visceral surface, because some important structures are related to it, then those structures make some impressions. They show that they were there, so they make their marks known. So these are the impressions that we want to see. So as we have already talked about, this is the superior border, because the superior border is often notched. Okay, this is the posterior extremity, and this is the anterior extremity. So this superior border, which is often notched. Okay, just moving away from that, we have what we call the intermediate border. So from the posterior extremity extending downwards, okay, we have what we call the intermediate border. And then even downwards, which can also be notched, okay, although usually not notched, is what we call the inferior border. Now one thing that you can also know is that this anterior end or this anterior extremity can also be notched, because at the end of the day, developmentally, there were these kind of splenic lobules which fused together to form this kind of spleen. So these notches, yes, they can always be there, and that is why failure of these fusion of these lobules can lead to what we call accessory spleens. So you have to actually appreciate this concept. Now moving away, yes, this one is the hilum, and the hilum is closely related to what we call the intermediate border. Now between the superior border and the intermediate border, related over there is what we call the stomach relating over there. So we have what we call the gastric impression. That's the largest impression that we find on the visceral surface of the spleen, the gastric impression. And so because I see that, yes, between the superior border, where it's often notched, and the intermediate border, I'm having this large impression over here being the gastric impression, then I know that I'm looking at what we call, this border becomes the superior border, and therefore this is the intermediate border. Now between the intermediate border and the inferior border, we have what we call the left kidney related to it. Okay, and that is what we call the renal impression. That is the renal impression, okay, coming from the left kidney. That is what we find. And at this level, okay, closer to what we call the anterior extremity, okay, over here, this broad region is the impression for what we call the colon, because we know that this transverse colon eventually bends and gives us what we call the left colic flexure. And we know the left colic flexure, because of the relation with the spleen, that is why we also call it the splenic flexure. Okay, so these are some important relations that we have over here, and that one will also help you to know which border you are looking at, because at the end of the day, the superior border from the intermediate border, the largest impression over there in the visceral surface of the spleen is the gastric impression. Now from the intermediate border to the inferior border, we have the renal impression for the left kidney. Okay, and we get to the expanded region, which we have the anterior extremity. At that portion, we have the colic impression. So these are some things that you can know to tell us that we are looking at all these structures. And once you come over here, you know that at the hilum we have what we call the blood vessels. We have the renal vein. Okay, so that's the renal vein leaving that substance of the spleen. Okay, the renal vein will be leaving, and of course the renal artery will actually be entering. Okay, so that is what we find over here. And one other thing that you should know, yes, that at the hilum of the spleen, okay, that area which is devoid of visceral peritoneum, okay, is what we call the pancreatic impression. That pancreatic area, for the tail of the pancreas comes and relates over here. And that is why the tail of the pancreas is an intraperitoneal structure, because it picks up that kind of peritoneum from this area where it relates to the spleen. We will see the various variations that we find at the hilum, where this pancreas, the tail of the pancreas will be latent. We will see those differences. We will see that. So there we are. That is the difference I want to show you, and the differences is that you can see that this is the real hilum of the kidney, where the tail of the pancreas is roughly 50% of all individuals, that's where it will be relating to. Then the next one will be at the lower aspect of the hilum, which of course is shown in this one that I showed you. Okay, you can see that it was at the lower aspect. That is the lower aspect. Okay, so in about that kind of 50%, the tail of the pancreas will be related somewhere here, and in that 42%, it will be related a bit lower to the hilum of what we call the spleen. Okay, that's what we find. And in roughly 8%, it will go above the hilum of the spleen. So these are that kind of variations that we find regarding, how the tail of the pancreas relates to what we call the hilum of the spleen. So, one important thing is that we know that the spleen is supplied by what we call the largest branch of what we call the celiac trunk, being the splenic artery, which takes a tortuous course, yes, above what we call the tail of the the body of the pancreas, as well as the tail of the pancreas. Okay, that is what we call the splenic artery at the superior border of the pancreas. Okay, and the splenic artery, because as it runs over there, yes, we know that it's going to give some branches to this pancreas, the body of the pancreas. It will give those branches, and the largest branch, we know that is the arteria pancreatica magna. Okay, we'll be giving all these branches, but at the end of the day, it will also give off some short gastric branches. Okay, we have some short gastric branches also supplied. Okay, and it gives those branches also supplied to the fundus of the stomach. Apart from that, it will also give a branch, okay, which we call it, what we call the gastroepiploic, vessel, gastroepiploic arteries. The left gastroepiploic or gastroomental artery will be coming from, of course, the splenic artery. But right now, what I'm interested in showing you is that, yes, you can see that the spleen, okay, is in close relation to, of course, the left kidney, as well as, of course, the stomach. And therefore, there are some ligaments which will contain some important structures. Okay, we know that the ligament between, of course, the spleen and the left kidney is known as the linorenal ligament. And linorenal is the same as splenorenal, because the term lienal organ, yes, we are talking about the spleen. And then apart from that, relating, okay, there's another ligament from the spleen to what we call the stomach, and therefore that one is called gastrosplenic ligament or gastrorenal ligament, okay, over here. So then the question is, what are the contents of these ligaments we are talking about? So when we talk about the contents of this ligament, okay, this one is from this left kidney all the way to the spleen. Okay, that is what we call the splenorenal or the linorenal ligament. And this linorenal ligament will contain the tail of the pancreas. The tail of the pancreas will be in there. Not only the tail of the pancreas, it will also contain the splenic artery, as well as the splenic vein will also be there. Okay, so these are the contents of what we call the linorenal ligaments or the splenorenal ligaments. The tail of the pancreas, the splenic artery, the splenic vein. And that is why it's very important that, for instance, if there is an indication for splenectomy, the spleen will have to be removed, then care must be taken so that you don't cut through this kind of ligaments. And this ligament, the linorenal ligament, once you cut it, the likelihood that you are cutting through the splenic artery, so a lot of blood will be coming out. Not only that, the splenic vein will also be suffering. The splenic vein is one of the most important tributaries of what we call the portal vein, the formative tributaries of the portal vein. Not only that, the tail of the pancreas, very importantly, and we know that the tail of the pancreas, yes, that is where we have high concentration of the islet of Langerhans. We know islets of Langerhans form what we call the endocrine portion of the pancreas. For example, if you take the whole functional parenchyma of the pancreas, just roughly about 1% of functional parenchyma of the pancreas, yes, is what we call the islet of Langerhans, the endocrine portion. The endocrine portion having this kind of alpha, beta, delta cells. Producing this kind of, glucagon, insulin, of course, somatostatin respectively. So it tells you that if this one is cut, not only are you going to see leakage of what we call pancreatic juice, which has a lot of enzymes to digest the peritoneum, causing general peritonitis. Not only that, but the patient may also be suffering from what we call carbohydrate metabolic disorders, including diabetes mellitus. Okay, so that is why this ligament is very important. You have to know this relation, this ligament, splenorenal or the linorenal ligament, very important. Not only that, yes, this ligament, where is the gastrosplenic ligament or the gastrorenal ligament, yes, will contain what we call the short gastric arteries. Short gastric arteries will be in there. But not only the short gastric arteries, in addition, we have what we call the left gastro-omental or the left gastro-epiploic, vessels will also be in there. So these are some important relations of the kidney. Now, talking about ligament of the kidney, talking about ligament of the spleen, supporting the spleen from the inferior aspect, okay? That ligament, yes, is connecting all the way from what we call the splenic flexure all the way to inferior surface of the diaphragm. That ligament is what we call the phrenicocholic ligament. Phrenicocholic ligament is not shown over here, but what you have to know is that it's not, although it's not a ligament of the spleen, it is giving some kind of support to the kidney from the lower aspect. And that is why that ligament, that phrenicocholic ligament, is otherwise known as sustentaculum laimi, because it's giving some kind of support, it's sustaining this kind of spleen from the lower aspect. So one thing that you have to know, having seen what we call the arterial supply, having seen the ligament related to it, then one thing that you have to also know is that, yes, the splenic vein, as you can see over here, which will be leaving the substance of the spleen at its hilum, will be coming all the way this way, and it comes and meets what we call the superior mesenteric vein. But one important relation that I have to know is that we saw that running at the superior border of the pancreas was the splenic artery, but running deep, okay, behind this pancreas is what we call the splenic vein. And as it runs over there, it receives those tributaries like what we call the short gastric veins, because at the end they give the splenic artery gives short gastric arteries. So the splenic vein will be receiving short gastric veins. Not only that, yes, it will also be receiving the left gastroepiploic vein, because we saw that it gave off the left gastroepiploic artery. Yes, not only that, we saw that the splenic artery gave these kind of branches to supply the body, the tail of what we call the pancreas. Okay, we said that the largest one being the arteria pancreatica magna. The same way it will be receiving the veins, okay, the tributaries from all these areas from the pancreas. And the largest one will be what we call the vena pancreatica magna. Okay, so that is what you have to know. But in addition, it will also be receiving, okay, from what we call inferior mesenteric vein. So inferior mesenteric vein also drains into what we call the splenic vein. Yes, the name is still called splenic vein. Okay, it starts as splenic vein, it receives inferior mesenteric vein, it's still called splenic vein, and then joining with what we call superior mesenteric vein behind what we call the neck of the pancreas, we form this roughly 8 centimeter long, okay, vein over here, being the hepatic portal vein to the liver, giving nutrient rich blood to the liver. Okay, so that is one thing that I want you to know regarding this kind of spleen that you have to know. I believe you find this meeting helpful. Okay, I'm sure in future editions we will do other important things. Okay, let me know your comment if you want some other additional things. Let's see what we can do about it. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.